Ladies and gentlemen, welcome to the annual Galien Award ceremony.
The Galien Foundation fosters, recognizes, and rewards excellence in scientific innovation to improve the human condition.
André Malraux said once in one of his novels, "Une vie humaine ne vaut rien, mais rien ne vaut une vie humaine." Human life is worth nothing, but nothing is worth a human life. All these men and women are trying to save human lives. Is there anything more noble than that?
Around the globe, the Prix Galien is considered as the equivalent of the Nobel Prize for the industry mobilizing an unrivaled network of Nobel laureates and top biomedical scientists. The Galien Foundation manages an independent, cross-functional, and geographically diverse program of events and sponsorship to brand the best of the best in new medicines and diagnostics. The Prix Galien is a welcome initiative to stimulate creative research and promote excellence. Barack Obama. The Galien Awards ceremony is considered the equivalent of the Oscars night for the innovators in the labs and awards every year the best pharmaceutical product, the best biotechnology product, the best medical technology, best digital health, best incubator, accelerator, equity, and best startup. The Roy Vagelos Pro Bono Humanum Award for Global Health Equity is bestowed to an individual, a company, an academic institution, or a non-governmental agency that has helped to improve the human condition through the application of biopharmaceutical science to problems of developing or underserved populations worldwide.
This is the right event, on the right issue, at the right time.
I thank His Excellency, the President, for bringing Prix Galien to Africa, and I look forward to the day when we will celebrate an African winner of the Prix Galien.
I'm particularly grateful to receive this award.
The awards are among the highest honors in science and commerce because they lead to improvement in the human condition.
The Prix Galien Awards recognize the world's brightest minds and most innovative companies. They are a true celebration of the hard work required to produce life-changing interventions.
That is what makes us optimistic about the future.
Congratulations to all of you.
Make a difference. Join the Galien Foundation.
As scientists, we live on the very edge between what is known and what is yet to be known, standing on the shoulders of giants to peer over the horizon, healing doubts as well as diseases. In the last 50 years alone, we've seen miracle babies who now have babies of their own, who may grow up never hearing the words smallpox, polio, measles, and live decades longer than their grandparents. Why? Because science. We witnessed a whole new body of medical advances that came from inside the human body itself. Because science. Heartbreaking quilts stopped being made. Artificial hearts started beating. SARS was contained and controlled. Whatever challenges humanity faces in the years ahead, the last 50 years shows us that we can prevail. And even diseases like COVID-19 will one day yield. Why? Because science.
Ladies and gentlemen, we are pleased to share a special address by Dr. Tony Fauci.
Good evening, everyone, and warm greetings to the Prix Galien Awards committee members and all the friends and supporters of the Galien Foundation gathered at the American Museum of Natural History in New York City. As a physician scientist and public health advocate, as are many of you, it is an honor to return to this forum, albeit virtually, to celebrate scientific innovation and achievement. In 2013, I had the extraordinary and humbling honor to receive from the late Professor Elie Wiesel, a Nobel Peace Laureate and founding honorary president of the Galien Foundation, the Pro Bono Humanum Award from your organization. In 2007, this recognition was first given to Dr. Roy Vagelos, an accomplished drug development scientist and an industry leader, and wisely, the Galien Foundation now continues the tradition by each year conferring the Roy Vagelos Pro Bono Humanum Award. Whether we are struggling against HIV, Ebola, COVID-19, or other challenges to public health, government and academic biomedical researchers and industry are stronger when working together. Our partnerships optimize our combined talents and strengths. Additionally, it is critical for us to team up with civic-minded allies to successfully engage the public in understanding and utilizing our health research advances to benefit the health of individuals as well as that of their families and communities. That is why the presence here tonight of the global film star and humanitarian, my friend and admired colleague, Miss Sharon Stone, is vitally important. What an amazing woman. For more than 30 years, she has volunteered her time to draw attention to areas of unmet medical need, focusing today on the 38.4 million people in the world currently living with HIV. Sharon, thank you so much for joining us, giving voice to our public health advocacy, and adding your star power, your singular beauty inside and out, and your passion to that of the scientific superstars attending this gathering. The public-private partnerships that have resulted in effective diagnostics, vaccines, and treatments to fight our current most pressing public health concern, the global COVID-19 pandemic, are working well to save lives, to keep people out of the hospital, and return some normality to our lives. Yet our work must continue since our control of the global pandemic remains tenuous. Success depends on our ability to stay one step ahead of the virus as it continues to evolve, especially as we enter the cooler fall and winter months and people congregate indoors. But that is why this gathering and you all matter. Each of you is at the forefront of ameliorating and resolving public health problems through scientific discovery. You are doing work that ultimately will sustain and save people's lives. That is worthy of true honor, whether you are nominated for a Prix Galien or are an actual award recipient. In that regard, tonight it is my pleasure to share with you that our friend, Dr. Stanley Crook, will receive the 2022 Roy Vagelos Pro Bono Humanum Award. Last year, Stan retired from Ionis Pharmaceuticals and its board of directors to focus on the nonprofit organization he founded, the N. Lorem Foundation. Thankfully, Stan has been relentless in his scientific pursuits, and his name is now synonymous with his work as the pioneer of RNA-targeted therapeutics. Stan, your dedication to the RNA-driven antisense platform provided a novel, highly personalized pathway to overcome difficult biomedical challenges and ultimately develop treatments for a variety of infectious, inflammatory, and cancer targets. Nearly a dozen antisense oligonucleotides have been approved for clinical use since 1998, and additional clinical trials in areas of unmet medical needs, such as neuroscience, are currently underway. Tonight, you also are being recognized for being among the first in the industry to commit to open science, a key element of the modern R&D enterprise, and to embrace the principle that patients with the rarest diseases deserve the best talents and dedication industry can offer. Untold thousands of people with little hope of a cure may benefit from your belief in the promise of this entirely new class of medicines. Stan, thank you for moving us forward with your passion, your commitment, and your knowledge. Finally, I congratulate the Galien Foundation on your Golden Jubilee. To all assembled here, continue your outstanding work and please enjoy the rest of your evening.
Ladies and gentlemen, please welcome our moderator tonight, Ms. Sharon Stone.
Good evening. What a pleasure and privilege it is to be here tonight in this historic New York landmark, a living museum where science, man, and nature reside, all in perfect harmony. What a wonderful idea. And a tribute to the work that all of you do here, every day, easing the burden of illness, a destiny we all share as part of life's journey. What would we do without the vaccines that have made it even possible to show our faces tonight? This is not a gift, it's a miracle. One where biology and engineering combine to meet the moment to save 20 million lives in the first year of this pandemic alone. I'm in good company tonight. My friend and collaborator and inspiration, Dr. Tony Fauci, told me this would be a great gig. I'm touched that he points to me as an example of why medicine needs more allies, able to advocate for the true facts about science and how innovation has led to so much progress in treating and curing disease. Truth is, I never needed any convincing to join the team for science. That I'm standing here tonight is due to scientific advances in neurology that ensured my survival from a ruptured vertebral artery and a stroke that nearly killed me back in 2001. At the young age of 43, I lost my speech, my looks, my mobility, and most importantly, my confidence. It took a decade of rehabilitation to get it all back. That I lived is due to the basic research on neurobiology and clinical science conducted by the Nobelists and researchers associated with the Galien community over the past 50 years that we celebrate tonight. Their work allowed me a second chance at life, to resume my craft as an actor, and to see my 3 wonderful boys blossom into adulthood. There is no price that can be paid for such a privilege, but thank you. Enough about me. We got a lot of leaders in science and innovators on hand to join me on stage in the next hour. And as we do that, it's only right that we take a closer look at the next generation of researchers, young men and women who seek to combine scholarship and activist mission to transform the world they inherit. Let's now hear from Laura Benoit, a young neurobiologist at the Roy Vagelos College of Physicians and Surgeons at the Columbia University, who will answer the question, why she became a scientist.
Thank you all. So my name is Laura Benoit, and my path to medicine and science has really happened quite organically. I'm someone who's always had a lot of interests, a lot of varied interests. I really enjoyed my math and science classes. I love talking to people, and I've always had a passion for global equity and issues of social and racial justice. And so I was thrilled to discover that there was a field where I'd be able to combine a lot of these interests, namely in scientific research and in medicine. I'm now coming to the end of my MD-PhD program. And while I know that this is a field with great aspirations of improving quality of life for all people, I also know that it is one that has a lot of flaws, and it often falls far short of that lofty goal. As I look forward to the rest of my career, moving to psychiatry residencies next year and beyond, I am motivated to contribute to moving the field forward by increasing our understanding of inequities that exist and also improving equity in the mental health care for all people, regardless of identity or background. Thank you all very much.
Thank you, Laura. We'll be hearing from other students later in the program. I'd like to add that the work of Laura and many other young scientists are being advanced by former Galien Award Committee Chair Roy Vagelos' recent action to fund tuition costs for students at the Columbia Medical School that now bears his name. It gives every promising student, without regard to money or background, an equal chance to fulfill their dreams. On behalf of all of us gathered here, let me say how pleased I am that a man I met years back who agreed to work with us on access to the antiviral drugs that transformed AIDS treatment is setting yet another philanthropic, I can say that, philanthropic treatment. Ensuring we have the human capital in place to deliver a healthier future for all. And we thank you for that. Now, for the highlight of the evening, the Pro Bono Humanum Award. You can get that. That really makes the annual Galien event stand out as something special. I'm channeling here the enduring legacy of the late Galien founder, honorary founding president, and the memorist for one of civilization's darkest chapter, Holocaust survivor, Dr. Elie Wiesel. Back in 2007, Dr. Wiesel conceived the Galien Pro Bono Humanum Award to signify those who exemplify the moral mission of science to make the world more just in the pursuit of good health, not as a privilege for the few, but as a right for all. I'm proud to introduce this year's recipient, Dr. Stanley Crook, who is being honored for his work in building a new biological Dr. Crook is being honored for building a new biological ANT-CESS pathway for development of personalized patient-direct treatment for multiple conditions ranging from cancer to inflammatory disorders and infections. More important, he is applying this knowledge to building a new nonprofit foundation model that will support development of personalized treatments for the ultra rarest of life-threatening conditions, without reference to normal commercial constraints. In other words, treatments that work for the neglected few. For free, for life. Congratulations, Dr. Crook. Please join me up here.